People often come in to see me because they say they look tired and that they have bags under their eyes. Bags can be virtually anything. It can be puffiness, it can be actual volume depletion, it can be a combination of the two. So it's really important to have an exam. I can't really just say based on a comment. I really have to examine the patient. If you're puffy, that could be because of the 3 fat pads that live underneath the lower eyelid. We have one medially, centrally, and laterally. It could be because you've lost some volume with age. The midface starts to descend downward, and that makes the distinction between the eyelid and the cheek much more noticeable. So when you're more youthful, you can't really tell where the eyelid ends and where the cheek begins, but as we get older, as that whole face starts to descend, you can actually see the differentiation of where the eyelid ends and where the cheek begins. That's called the anatomical tear trough. And so if you have a volume depletion there, you can actually look hollow, and that hollowing creates a shadow, and it's that shadow that sometimes people call bags. So it depends. If you have too much volume, then ideally the gold standard would be a lower eyelid blepharoplasty. If you have mainly volume loss, then volume replacement would be the ideal. So there you could use anything from injectables like hyaluronic acid, or if you thought that that was a good option, then later down the line you could also go on to have surgery or a fat transfer to actually volumize that area. I always tell my patients that it's much better to go down the route where you can reverse a treatment as opposed to going down a surgical route first. So if you do have volume depletion, it's super simple to place a few drops of meticulously placed hyaluronic acid in that volume depleted area. If it's something that you like and you decide, I don't really want to be doing this on a yearly basis, then you can always go down and have a more permanent type of treatment like a surgical procedure, which would involve fat transfer to the area.